Well, I think Dr. Aad spoke on, about our organization, Palestinian Medical Relief Work, where 25 teams are working on the ground in the north, in the center, and in the south of Gaza. And I think he gave you a very clear idea. What I want to say is that what Palestinians now are subjected to, not only in Gaza, but also in the West Bank, is 3 war crimes at the same time, in parallel. The war crime of genocide, the war crime of ethnic cleansing, and the war crime of collective punishment. And clearly the number of people killed is so tremendous. We're talking now, if we count the people missing under the rubble, you're talking about almost 19,000 people. That is more than 2.5% of the population of Gaza. Had this happened in the United States, you would be talking about at least 6 million people injured or killed by this terrible situation. The number of Palestinians killed, if you compare it to the United States population, would be more than all the people killed in the United States in all the wars of the United States since the 18th century. Mr. Guterres spoke about the fact that the number of Palestinian children killed already in Gaza is actually much more than all the children killed all over the world in all the wars during the last 3 years and probably 4 years. So it's drastic. What we need more than anything else is immediate ceasefire, immediate pressure on all the governments to initiate a ceasefire. Because without stopping the killing that is taking place, without stopping the bombardment, all the efforts will go in vain. And the problem is not only related to the number of people killed or injured. At this moment, there are 55,000 Palestinian women who are pregnant in Gaza, and about 5,500 of them will be giving birth, and some of them have already given birth in the streets. It's a big disaster. These women are now already suffering from malnutrition, and their children will also be suffering from malnutrition. There is not enough food, not enough medicine, not enough water, not enough clean water. One thing that is worrying us a lot now is the possibility of the spread of infections and epidemics. We are anticipating, because of lack of clean water, we are anticipating that there will be spread of diarrhea, but more complicated things like typhoid, hepatitis, and even cholera. Of course, with this crowded situation, some of my colleagues from medical relief told me that they have to sleep in the same room with 60 people. And in other cases, there are 200 people in one room that is no more than 16 square meters. So you are talking about, of course, very high possibility of terrible infections spreading. And we are absolutely sure there will be an outbreak of measles because all the vaccination programs have stopped since more than 46 days. The problem that we face today is that Israel has been attacking hospitals in the north and in the center with 3 aims. The first aim is to destroy totally the infrastructure in Gaza City and the north to make it impossible to live there, to make it improper for people to live. And the main goal of this attack is not only to destroy the most important health services in Gaza, since Shifa Hospital is, by the way, was the largest hospital in mid-Palestine, not only in Gaza, not only to deprive people from these services, but more than that, it's about destroying any possibility for people to come back. And it's about also evicting people. It is well known that thousands and thousands, at one point 60,000 people were taking refuge in Shifa Hospital. So the problem we deal with now is that since Israel could not up till now evict everybody out of Gaza to Egypt, and thanks to the steadfastness of the Palestinian people and their heroism, and thanks to the fact that our countries did not cooperate in this terrible ethnic cleansing plan, now the Israelis are turning to Plan B, which is complete and total ethnic cleansing of the north and center of Gaza. That's what should stop. And that's where international pressure should go, to stop the process of ethnic cleansing, to force Israel to withdraw its occupation from the area of Gaza and allow people to come back. Because Gaza cannot survive without the northern part of Gaza or the center of Gaza. On the issue of collective punishment, let me tell you that what Gaza received up till now does not exceed 1,100 trucks, while the real need at this very moment is no less than 26,000 trucks, because Gaza used to receive 500 trucks every day. And the most important thing is that they're not allowing fuel to go and flow into Gaza. Everything that relates to healthcare is a problem. We have more than 1,200 people who are in need for kidney dialysis. Many of them have already died. We have children who will die because there is no incubators for them, especially premature infants. There are people who have cancer who have already died and will die because there is no treatment whatsoever. We know that many facilities in Gaza are incapable of treating many diseases, and that's where people should be able to leave Gaza and come to West Bank or Jerusalem, and that is of course all stopped. So I think I'll tell you one story about what one correspondent described about the situation in the north of Gaza today. If somebody is injured, there will be no ambulance to take him to the hospital. If somehow some people take him and get him to a hospital, he will not be able to receive anything more than just simple first aid on the ground floor of the hospital, because there are no beds empty and the place is full with injured people who are not treated. Most probably this person will die. And after he dies, he will not be buried immediately, because it is impossible to carry the body to the cemetery because of the Israeli continuous bombardment. And if there is a break in the bombardment, the cemetery is already full. And that's why now our colleagues in the Indonesian hospital are talking about finding a space inside the hospital to make it a graveyard for people. It's exactly what Guterres described as the fact that hospitals have been transformed into graveyards. So I don't want to speak too long because many people have already spoken, but I want also to alert you to the fact that we are also witnessing a lot of problems in the West Bank, where we are encountering not only army attacks on people, but also settlers attacks on people. What we face here is 750,000 illegal settlers who are armed to their teeth and who are terrorizing people, trying to imitate the same kind of terror that was used against Palestinians in 1948, creating the worst form of ethnic cleansing ever. And now they are trying to repeat that. Already 35 communities in the West Bank have been evicted because of the settlers' terror. We run about 14 mobile clinics. Medical Relief runs 14 mobile clinics in Area C, which is not served by anybody else. But even our mobile clinics have been prevented to reach many communities now in Hebron because of the army is preventing them. The same in Tulkarem and Jenin as well. So in the West Bank, we are also encountering this terrible attack. Already we've lost more than 216 people killed by the Israeli army since the 7th of October. And before that, 240 people were killed, including 40 children. And that is why, by the way, there was an attack on the 7th of October, because Gaza was responding to what was happening already in the West Bank. So what we need here is really immediate pressure on the governments. Any government that is not supporting ceasefire at this very moment is practically not only complicit with the war crimes that are happening in Gaza and in the West Bank, but actually participating in them. And that should be clear. It should be told to everybody that this has to stop, and immediate ceasefire is the most important thing that we need now. And then after that, we can speak about what will happen after in Gaza Strip. I am very glad that Matt told you and told us that he got $1 million support from the Norwegian government, but I want also to alert you to the fact that the countries of Sweden, Germany, Italy, Switzerland, Austria, and EU suspended all their support to Palestinian non-governmental organizations, including all those working in the field of health. We're talking about 76 organizations that have lost the support now in response to Israeli pressures that is conducted by three very dangerous organizations. One is called NGO Monitor, the other one is UK Lawyers, and UN Watch. They're all run by Israeli intelligence, which aim is to dry up any support to any Palestinian living in the occupied territories. And the goal is clear here, to make life impossible, to break the steadfastness of the people. We will not stop struggling for our rights. We will not stop serving our people with our healthcare facilities, even if they stop all the support and aid from all over the world. But it is so shameful that some governments participate in the collective punishment of the victims, of the Palestinian people who are subjected now to this atrocity. So I think also you should raise your voice with your governments in these countries about this inappropriate behavior which is happening under the Israeli lobby pressure. My last point or my last request is that I think it is very important to bring in information to the people about the reality of what's happening here. I know there has been a big change already in the world, but we need more because the Israeli propaganda does not stop. And I want to clarify here that all they've been talking about regarding Hamas using hospitals as military headquarters and about the tunnels under the hospitals are all lies. We've exposed that already. And I want you to know that even Western media that is usually biased to Israel, including New York Times, CNN, Washington Post, and BBC, have all indicated and proven that the Israeli stories were incorrect and that Israel could not provide any serious proof of all the claims they were making about these hospitals. I think it was a scandal. And yesterday, Ehud Barak even reaffirmed the reality of this scandal about all the Israeli claims when he said, and Ehud Barak was the prime minister of Israel at one point of time, he said that one of the tunnels they speak about is nothing but an underground structure that Israel itself built when it was in charge of the Shifa hospital when they were occupying Gaza completely. So clarifying the reality to the world is very important. Informing the world about the reality of what's happening here is very important. And thank you for your support and your solidarity and for everything you do. I want just to add to what my colleagues said, especially what Dr. Aed said, that the cause of Palestine today is not a Palestinian issue or an Arab issue or a Muslim issue or a Christian issue. It's an issue of all humanity. It's the most important liberation struggle worldwide, and we thank you for all your support and solidarity. Thank you.